Hello everyone, this is Ronnie Smith coming with another video update on everything we've been doing at the Ralph H. Johnson VA Medical Center related to COVID. It's been a few weeks since I've done a video update, so I have a few items to cover for you. First, I want to let you know about some of the statistics related to our COVID response. Currently, we have 5 veterans inpatient here at the main facility in Charleston. A few have come from some of the nursing home facilities around the state that we're supporting, and a few have been admitted from veterans that we see on a routine basis. As we've been seeing an uptick in the number of COVID positive out in the community, we're seeing some impact here as well. We have 16 PUI outpatients. Those are people under investigation. That means they've been tested. We're kind of waiting for results. We currently have 2 employees that are PUI, and we have 1 positive employee right now. And I want to really compliment what that employee did. As soon as that person felt they were ill, they let their supervisor, employee health know immediately, stayed at home, got testing, and is getting treatment appropriately. We really appreciate that person making sure they're taking care of themselves and plus everyone else here at the facility and their veterans. As far as our reopening plan, as we've been communicating out, we're a pilot site for reopening, and we've been firmly moving through our phase 1 of our reopening. We are pausing at phase 1 due to the volume of positive COVID cases out in the community to make sure we can stay safe in our reopening and just kind of watching the trend that's going around in the community to see if that solidifies a little bit before we move to phase 2. We are providing more and more care in-house, face-to-face, and so we'll be seeing more veterans here. And so we want to make sure we're doing it in a safe environment. We really appreciate everybody's efforts throughout the organization as they set up the best environment possible as we're bringing veterans back for care. We have a consolidated entrance to the facility here at the main campus back to only at the emergency department for veterans. We moved the infusion clinic once again because we needed the space that they're using as part of a reopening plan. And so the reason we had opened up the front part of the hospital was for the infusion clinic. With that move, it's not really as necessary. And so for this phase 1 of the reopening, the next couple of phases, we can comfortably move back to only having the ED as the main entrance for our veterans. Employees will continue to use the rear entrance. We have set up a waiting area in the research or DD building, as we call it, for veterans to wait before they come in for their appointment. We are trying to limit the number of people that come in and limit when a veteran can enter for their appointment. And so we have a waiting area outside of the main hospital for veterans to wait while they're waiting for their appointment. As it gets hotter, it's not really appropriate sometimes for them to be waiting in their car. We want to make sure they have a safe environment, and so we've created that outside space for them to wait. Additionally, we know some of the best ideas come from our team members, so we continue to encourage people to submit any questions or concerns or suggestions they have to our Q&A email group that you see here. And so as we continue to open, we'll continue to learn lessons about how we continue to maintain our social distancing, proper precautions, and help implement those as we move through the next few phases. One of the things we do want to mention, as business reopen, the communities lifts stay-at-home orders. We have telework employees coming back. We need to continue to stay cautious and make sure we're abiding by all the safety precautions we've put in place here at the facility, and that includes our masking policy. We've asked everyone that's within their building when they're meeting with others and in public areas that they're wearing their mask. And sometimes we're seeing some non-compliance with that as we walk around the facility. So we want to make sure everyone has their mask on over their nose, down over their chin, covering their mouth at all times. If you see someone that's not wearing their mask, just politely ask everyone to support each other and making sure they're wearing that mask. That includes me included. If you see me walking around without the mask, please encourage me to do so. We can do that in a very polite manner, but this really is about the safety of everyone involved. Not only you, but all your fellow colleagues, family members that are here, and our veterans that are here, just to keep them safe. And then I have two items I want to touch on base as well, non-COVID related. One, of course, is as demonstrations and protests continue around the country and around the world in the wake of George Floyd's death and the civil unrest that's come from that. It's imperative that we all recognize and discuss the tension and pain behind this important movement, but to be able to do it in a very professional manner. It's important to remember our commitment to and for caring for our veterans of every age, gender, race, and identity. So I encourage you to take care of yourselves as well. If you have any intense pain, emotions because of this movement, and you need some assistance, please know that the Employee Assistance Program is available to help you, and to please reach out to your supervisors chain or leadership if you need help. Our chaplain service is also making themselves available and can talk to staff as well, so feel free to reach out to them. I encourage you to help as we go through this and deal with the situation and be able to express ourselves with everything that's going on. So please don't hesitate to reach out if you need to. Lastly, we're now officially back into hurricane season. You know, the hurricane season runs through June 1st through November 30th, and we actually had 3 named systems even before the hurricane season officially started. So I want to encourage everyone to be proactive. As you know, it's been the policy here for years in Charleston, being on the coastline, that everyone is essential during a hurricane event, and as part of our emergency plan. There's so much work that goes into getting prepared for a hurricane, when a hurricane comes, and after a hurricane, to help each other and to take care of the over 80,000 veterans we serve every year. So it's imperative that we all refresh ourselves on our role during the storms, be able to report to their work and their supervisor as required, and have a plan for your family in the event that a storm comes. Employees need to be ready. You know, I have an A, B, and C plan myself, and just kind of think along that line. So, as part of our sector mission as healthcare workers, we have to be ready to prepare to serve our veterans even during a hurricane, and so ask you all to refresh on what will be expected when that time comes. That is all I have for this video session. I hope to be able to talk to you very soon. Stay safe, keep washing your hands with soap and water, wear your mask, and if you need help dealing with everything with the protest and the civil unrest, please reach out to your supervisor or the EAP program. Thank you very much.